Hi, my name is Michael Robbins. I'm a licensed clinical psychologist with a PhD who works in Providence. I work with a wide variety of different people. I work with children 16 years or 17 years old, and I also work with a lot of college students. I do see couples as well as individuals. In my work, I see people who struggle in relationships or who are trying to decide what to do with their life, who are in transitions, and I also do a lot of work with people who have anxiety disorders or depression and are struggling with those sort of longer term issues as well. I like working with a variety of different types of people from different cultures as well as a variety of sexual orientations. I was trained both in San Francisco and New York, and what I liked about working there was the wide variety of people that I got to work with. I also took some time off and backpacked around Europe and Asia and India, and I found that exposing myself to those cultures and having to understand where people are coming from has really informed my work that I do here, trying to understand where my clients are coming from and understand them from their cultural perspective. In terms of the modality of work that I do, I was trained psychodynamically, and I really see that as the basis of my work. But I also found early on in my career that CBT was a very important aspect and supplement to that work. So if I would summarize my modality, I would say that it's psychodynamically informed, and I treat each person that comes in and the symptoms that they have, and we determine together what would be the best way of looking at that. One thing that people should know about the way that I work is that I tend to be a little straightforward, sometimes pretty humorous, and I try to be direct with people. The most important part of therapy is the relationship. That seems to be what all of our research has found. And I find that I like to check in with people quite often during the therapy to make sure they feel like we're on the same page, we have the same goals, we're headed in the same direction. It's difficult to be in college. It's difficult to be in a transitional time in your life. And I think that it makes a lot of sense to come to therapy and talk with someone who can help you sort out the larger questions in your life so you know where you want to go and who you want to be and what you want to do. I think when people come to therapy, what they're really looking for is they're trying to figure out how they're getting in their own way. And I feel like my job and what I find exciting about the work is trying to understand something from someone else's perspective and to help them see the long-standing ways that they've gotten in their own way or the acute short thing that in this moment is getting in their way. For example, if someone just had a breakup and they're thinking they'll never meet someone else, that belief gets in their way of moving forward and moving on and finding something to make them happy again. But what I find also even more exciting is the longer work, when you see people who've had patterns of getting in their own way or causing their own problems and helping them sort out what those patterns are. I find that very rewarding.